So as part of our CZI Rares 1 grant, we've been given an incredible opportunity to join a natural history study. And so we wanted to take this time at the conference to talk about it and the benefits of it and how it can help our community. All right, so Citizen Health is a company founded by rare disease patients for rare disease patients. They are putting together these natural history studies which allow us to better understand our communities, better understand the challenges that they face, and help us to manage our own care as well. So as we are working towards different treatments and different options for our families, we come across major roadblocks. A lot of patients drop out. Not all cases are supported, and it's a long, expensive process, which means that it's a high patient burden on our patient community, right? So Citizen Health is aiming to eliminate some of that burden so that it is not quite as cumbersome. They empower patients, advocates, researchers, and drug developers with real-world insights from patient-consented data. Natural history studies are the cornerstone of rare disease research. It helps to observe and understand how the disease develops and progresses naturally, establishes baselines, essential for researchers and medical or measuring treatment impacts, and design better and faster clinical trials. Lack of knowledge of natural history limits the ability to understand the conditions and patient unmet needs. So how does it work? So essentially what we do is we give this to our patients for free. There's no cost to our families to be involved. You control all of your data. You control who sees it, who has access to it. You go in, set up your account, and they will go about collecting your medical records. My 19-year-old daughter is our beta tester of this, and I have to say it has been a very easy process for us, and it's already been very, very instrumental in her care. So you go in, you're going to put in all of your locations that you have been seen. For us, she's been seen across the United States. And so they have collected, last time I checked, we were at over 5,000 medical records. And they have collected all of those for her. She controls who sees that. She controls, does she share it with doctors? Does she share it with HC? Does she potentially want to share it to researchers that might be interested? That was very, very important to me, is that our patients control their data. They get to own it. They get to decide who has access to it. This is not something that anybody should make those decisions except for the patient and their families. So a lot of different rare disease communities work with them. Chan Zuckerberg, they have done a lot of research into making sure that this is a trustworthy company. So pretty easy, you create your username, password, give them your basic demographic, and then you sign your consents. Enter in your providers, and they will validate your identity. So no cost. All your medical records are in one location, which is phenomenal. Easy to share. Went to a doctor's appointment with her. Her doctor was like, I'm having trouble getting these medical records. I said, oh, I can get those for you. Logged onto her account, and we had them within minutes over to her provider. You easily can contribute to research without ever leaving your home. And then my personal favorite part is there is an AI advocate. So imagine this. I send my nicely adult child to her first appointment by herself, and she comes back to me and she's like, Mom, have I ever taken beta blockers? And I'm like, yes, that was a bad idea. Don't do that again. Well, why? I'm like, oh goodness, how many years ago was that? I've got to remember that. I've got to go back and research it. And she had answered these questions to her doctor, and she just winged it. She's really good at winging it. And I am sitting there thinking, oh my goodness, we are in trouble. So along comes Citizen Health. Now I send her to her doctor. Her doctor says, have you tried high-level antihistamines? Yeah, I'm pretty sure I did that. When? I don't know. So I jump on. We get on the AI advocate, and I said, when did she try high levels of antihistamines? And it went through, and it's 5,000 pages, so it did take a moment to scroll through all of those and find it. But I had an answer in under a minute. I had dates that she had started it, the doses, why she was prescribed it, and why she stopped it within under a minute. Doctor furthermore goes on and says, I'm having a hard time finding, there's so many medical records. It's hard to scroll through all of these. I need to understand what happened when they tried this medicine for her. And I can't even find where it was administered, let alone how she reacted to it. So once again, log in to our handy dandy little AI tool, and it pulls that up, and it tells them exactly when she took it, what her reactions were, the measurements they took, everything that was documented about that. We're struggling to get the insurance to approve a medication. In the AI tool, it says, help prepare for an insurance appeal. Click on it, and I got a 7-page document of everything related to that condition and what might help the insurance. One of them, they wanted to know how many times the cost of what not treating her would have been. So they're like, how many times has she been admitted for abdominal pain? I'm like, oh goodness. I can't even count that high. Like, I can't even remember how many times. Jump on there, type in, how many times has she been admitted for this? 39 times. So it is a very, very powerful tool to be able to have that at your fingertips. And it's something I am so excited to be able to give to our community to allow them to have access to it. So as you can see, this is our AI advocate. There are so many different things that you can ask it. And the nice thing is this is not like ChatGPT where you're worried about the sources of where it's coming from. It is specifically pulling it from your medical records. They are very security conscious, so follows HIPAA compliance. They are above and beyond anything that I have found in order to protect our information. Our information, I am finding out, is quite valuable, actually. And there are people that really want access to it. And I want to make sure that that is secure and that we are only sharing it with who you are comfortable sharing it with. So this is where we get to start realizing the value of our information. So when we have a big enough cohort, and that could be 20 people in there, it could be 100, I can have companies, researchers come to us and say, we want to pay you to access this information. And that money comes to us directly. It does not go to Citizen Health. It comes directly to us. There again, you choose whether you share that information with them or not. You'll get a notification. You get to choose whether you are okay sharing that or not. They're working on getting this in different languages. Obviously, we have patients all over the world. And sometimes gathering medical records from across the globe is challenging. So they are bringing on translations about as fast as they possibly can. Right now, they are currently not collecting outside of the U.S. the medical records, but what they do recommend is that you get the medical records and you can upload them yourself. And then their AI assistant will pull that all together. One of the things I really like is that sometimes, as we all know, you read a medical record and you're like, they told me that they were diagnosing them with this, but it's not in the medical record. Or, maybe it says the patient has low muscle tone. Well, AI is going to link that to dystonia, and all of a sudden, we can start to find commonalities among our community. Little things that previously get overlooked because doctors word it different. Medical records don't always reflect exactly what the doctor told you. So a lot of options for us. So in less than 3 years, Citizen has enabled immense research acceleration for rare diseases. There's a big, big focus on this. So they have gotten over 11 manuscripts printed, 25 abstracts, 15 biopharma partnerships, and it continues to grow and develop with here. And with the influx of CZI funding, it will continue to explode. With Citizen, Praxis obtained IND clearance from the FDA 4 years early. When you have access to some of this information, it saves countless hours upon hours upon hours upon hours of research. Imagine what one little research assistant would have to do that now our AI assistant can do in just under, in minutes. So it's accelerating treatment drastically. So our goal in the next, by the end of the year, is to get 50 signups. This is something I'm passionate about. I've seen it in our lives. I've seen how it benefits us. I've seen my daughter walk into appointments far more confident in her ability to manage her own care. She no longer has to be like, I don't know that answer. She's like, wait a second, let me look that up for you. She comes across as a lot more prepared. We're not turning to ChatGPT for some of these answers. We're turning to our own medical records and to the assistant to help us with this. So obviously there's a lot of benefits to this, benefits to research, but the goal is to support our communities in the end. So as we find better treatments, as we find better options for our families, we need the research. And we need it to benefit our communities. I don't want to just give this to big pharma or anything like that just for the sake of doing it, but because it truly benefits our community. So it helps our newly diagnosed. It helps along the patient journey, helps with medical management and treatment plans. So as you can see, this will walk you through a little bit more just what it's looking for and what it will attach it to. It will attach it to ICD-10 codes, even if it is not specifically saying that that person has that. And then the nice thing is you can share this with your providers. Now, do be aware that sometimes providers, institutions do not allow them to access that, but you are able to share directly with providers. You just put their email in, and away they go. They have access to everything that you give them access to. So clinician and community support, we're hoping to explore better treatment patterns across cohorts to understand, are there opportunities to drive better standardization? Are certain ASMs or combination of ASMs used more commonly? How many ASMs do patients try? What is the use of polypharmacy in the population? So as we get more and more people involved in this, we can overlay key data to compare and to illustrate patterns in key outcomes over time. We can explore relationships between phenotypes, as well as associations between interventions and outcomes. The more robust we can get this registry to be, the more power we have behind the force that we put towards research. We can control and help to influence where research is done based off of the data that we share. So we will have pamphlets about this. We have them that will be at our resource this afternoon. So we'll have pamphlets that will have QR codes. Maria here has been our expert. She's done all the training, so she is going to have a computer that she can sit down and help you sign up if you would like. But Maria is our go-to for this. So does anybody have any questions? Mike. I know, Monica asks so many questions.
Hello. Okay. I know this information, with all the HIPAA and security, and we can give access to this information. I'm curious, I don't know if you know this, if, because heterotaxy, some of us have other diagnoses that we don't know are related to our overarching condition or not, and would this resource help us to weed that out?
Absolutely. So, my daughter was actually diagnosed last year with another rare disease that is 5 times more rare than heterotaxy. So it's been a challenge to kind of parse out what is heterotaxy, what is this other condition. And I can type into this AI assistant. I need everything about HAE. I need anything that pertains to her heterotaxy. Are there things that might overlap between the two? And it gives me that information. So this is not just going to focus on a heterotaxy. I know a lot of our kids have multiple conditions, and it will help you figure out what is what and help you find that documentation to support that. All right. Well, thank you guys. Once again, Maria will be at our resource fair and will answer any of your questions or any more questions or help you get signed up if that's what you are interested in.